Hi everybody, my name is Swati Maan. I'm a dentist and welcome back to my channel Teeth Talk. Today my topic of discussion is the treatment of the bleeding gums. In one of my previous videos, I talked about the reasons for the bleeding gums, and today I'm going to brief you on what are the treatment options you have. So let's talk about that. Number one, if your bleeding of gums only happen when you brush your teeth, that means to say when you brush your teeth in the morning and evening, and when you spit and you see some bleeding, that means, but you don't have no other symptoms, that means you're on the stage of gingivitis, which is an initial stage of gum problem. And the treatment for that is a scaling and polishing, which means a cleaning of your teeth by your dentist or your hygienist. They will clean all the plaque and tartar from your mouth, which is actually a responsible factor for causing the bleeding of gums. At this stage, we are very lucky because this stage is reversible. And if you start maintaining a good standard of oral hygiene and happy to make the changes which your dentist or hygienist might recommend you, then the things will come back to normal and the bleeding of gums will stop. But if you see the bleeding of gums more often, not just while you brush your teeth, plus you see other symptoms as well, for example, if you have swollen gums, if you see the redness in your gums, if you see there is some mobility in your teeth associated with some bad breath as well, these all symptoms show that now the gum condition is getting more towards periodontitis or has already gone to the level of periodontitis. Periodontitis is the infection of the gum and the surrounding structure. I will show you a picture here. This is a picture of a mild periodontitis or an initial stage of periodontitis, where we can see the plaque and tartar, the brown part, has now invaded into the gap between your tooth and your gum surface, and it has created a pocket. At this stage of periodontitis, your dentist might recommend you a deep cleaning because they have to go slightly deeper to clean the plaque and tartar which is inside the pocket. The procedure is painful. Of course, I would not lie to you. This is a painful procedure. So your dentist will numb your mouth before doing the procedure. And this is also a multiple sitting procedure because it takes longer than a normal scaling and polishing. So probably your dentist will recommend you 2 to 3 visits or 2 to 4 visits. Sometimes they want to do it in segments in the mouth, or sometimes they want to do it top arch first, followed by the lower. So the 2 to 4 visits are required to do the deep cleaning, followed by a good aftercare. At this stage, you can gain your health of the gums back to a good extent. But if the periodontitis have reached now to advanced level, that means the plaque and tartar has now invaded into the deeper tissues, which has also started to damage the bony structure as well. This stage is a severe stage of periodontitis, and you may need a surgery for that. And the best person to do these kind of surgeries are the gum specialists, also called as periodontists. So these are the treatment options that we generally recommend in dentistry when the bleeding of gums is due to or associated with inadequate oral hygiene, leading to plaque and tartar, and of course the treatment mainly involves the removal of plaque and tartar. But if the bleeding of gums is due to any health conditions, it's always worth having a chat with your dentist and your physician to make sure they can get you the right treatment planning and the treatment can be resolved accordingly. With the advancement in dentistry, we also have some laser techniques available, which can also help in the healing of gums faster. So again, this is a good point to discuss with your dentist whenever you see them for the bleeding of gums. As I always say in all my videos, in dentistry, sooner is better. And luckily, unluckily, there is no DIY for the dental problems. So it's always good to go and speak to your dentist and get the right treatment planning. And if you've got any questions for me, feel free to drop your questions in the comment sections and I'll try and get back to you as soon as I can. So thank you very much for watching. That's all for now. And you will see me in my next video with some more information about teeth. Thank you.